The biggest thing stopping patients from embracing physio is they don't buy in. Patients need to mentally buy into therapy to recover. Otherwise, you don't have a chance. Stay tuned and I'll tell you the 3 coaching elements that you need to cultivate in your patients so they don't resist. I saw one guy who sprained his small finger on his non-dominant hand and was completely disabled. He had seen multiple specialists, lots of imaging, had been to rehab several times. I saw him for 1 or 2 visits and referred him back to the ortho and said he needs psychological counseling. I've seen other patients with multiple fractures, multiple surgeries, and they're motivated and it clicks. There's nothing that works for everybody, but if that motivation isn't there, you're shoveling water uphill with a spoon. The biggest problem in physio is the non-compliant patient. This barrier I call the calamity of evil. Some people call it a mental roadblock or the blame game. I know it sounds weird, but let me explain. Nobody chooses to be in physio, not even total knees and total hips. They come from that underlying osteoarthritis. The solution to this evil is responsibility. I don't have a better way of saying it. I was in the dark, then I saw the light. I was lost, I was found. I was in chaos, and then I found peace. Patients have to go through those stages of grieving to get to the other side. That is to say, something has to happen. Patients have to go from blame to action. This is where we can help them by asking or clarifying what's the next positive action step. We're not going to argue about good or evil or religion or philosophy. I need to know what's the next positive action step going to be. Some might say that, whoa, this is psychotherapy, but this is an everyday, every patient issue. You've got to coach your patients into the right mental direction. I have 3 key elements to coaching your patient. First, it's positive rapport. Tailor your communication to their level and their needs. Whether it's a 14-year-old who wants to do skateboarding or a 60-year-old who just wants to do their own shopping. You have to speak to their mental level about their needs. The second coaching element is to focus them on the one key physio thing that they need right now. What's the most important thing that they need to focus on in therapy? Keep it simple. For example, knee extension after knee surgery, or safe use of a walker to foster their independence walking. The third coaching element is that the patient has to be involved. Some people call this a therapeutic alliance. Some people call this patient-centered care. Some people call it collaborative care. I don't care what you call it. And it's not just focusing on patient goals. It's the home program. It's that shared responsibility. Most physio recovery occurs between visits. So tell them, don't make things worse. Pain-free exercise use, and it's okay to rest. If the patient isn't doing their therapy, then it's just you, the therapist. And that's baloney. I don't put on my pants and go to the clinic just to feel good about myself. The patient has to be there for it to work. And you need to coach them along this journey. Everyone has seen patient disasters. Everyone's seen patient miracles. Tell us about your amazing patient recovery stories in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. If you want more, click on another video here or subscribe to stay in the loop. Thank you.